like to thank everyone who's here today on this webinar for our very own Medley uh, Provider Spotlight Series. I want to thank Dr. Kadali for his time. Good afternoon, everyone. My name is Shah. I'm a clinical pharmacist here at Medley, where I work on our clinical programs and patient education uh, initiatives. Um, Dr. Kodali is a gastroenterologist in Cary, North Carolina at Park GI. And we're grateful to host him here. We're grateful for him that he works with Medley with our patients. Dr. Kodali, why don't you get us started? Tell us a little bit about yourself. Tell us what do you do? Give us some information on your background.
Yeah, thanks, Varel. Thanks. I really appreciate Medley for giving me the opportunity and doing this webinar. After I finished my medical education in India, I came to the United States in 1986. I did my internal medicine residency at Long Island College Hospital in Brooklyn, New York. Then after that, I went to University of Miami Center for Liver Diseases to do hepatology research fellowship. Afterwards, I did 2 years of gastroenterology fellowship at Beaumont Hospital in Royal Oak, Michigan. From there, I went to Mayo Clinic to do an additional year of therapeutic endoscopy in gastroenterology. And then I moved back to South. I started practice with 2 other physicians in Fayetteville, North Carolina, called Fayetteville Gastroenterology Associates. We took an old physician's practice. 3 of us started together, and then we improved that. And right now we have about 13, 14 providers in that practice. After 25 years of practice, with that group practice, I decided to retire from there and started a new practice where I live now in Cary. It's western part of Cary, which is a rapidly growing area in Cary. So I started this in February. Probably you all heard Apple is coming, which is a couple of miles from my office. They are bringing 3,000 jobs and $1 billion investment into this research triangle park.
That's amazing, and congratulations. And thank you for providing us with all this information. It looks like your career trajectory, and you've done a lot of amazing things in your practice, and you're doing great things for the community. And like I said, we're very grateful to work with you. Again, this webinar is about the colon cancer screening, and I'm just going to go ahead and ask you a few questions. So recently in the news, we all know that Chadwick Boseman, who is an actor, passed away at the age of 43 from colon cancer. And American Cancer Society recently also updated their guidelines where they're recommending that people at the age of 45 should get screened for colon cancer. Can you provide some insight into that? Why did they make the change? And why is it better for people to get screened, at a young age rather than waiting until, maybe they are symptomatic, or maybe they feel that there's something that they need to get looked at?
Yeah, sure. I don't know whether you're aware of that or not, colon cancer is the 3rd leading cause of cancer in this country and the 2nd most common cause of cancer death in the United States. About 150,000 people are diagnosed with cancer every year, and out of them, 45 to 50,000 people die of colon cancer every year. This cancer is very preventable and also curable if it is caught in early stages. As I said again, it is a preventable cancer if we get this screening done. The previous recommendations were anybody over the age of 50, they need to have screening colonoscopy or some kind of screening modality done starting at age 50 and carried until the age 75. But because of doing that in the past 20 years, the incidence of cancer as well as mortality from the cancer has gone down significantly over 20 years from population 50 to 75. But during the study, what they have found is we started seeing colon cancer in younger patients starting at a younger age. And also the cancer is more common and also in younger patients, and we started seeing at a younger age. I recently have a friend who has two kids, very healthy lifestyle, and he had cancer at age 42 and metastatic stage 4. It was unfortunate, and that's not an incident, but the studies have shown that we are seeing in younger patients, and also the cancer we see in African Americans also even higher, and it is more deadly for unknown reasons. One of the some of the risk factors for this cancer are African American race, obesity, smoking, alcohol, excessive intake of alcohol, eating too much red meat or processed meat, sedentary lifestyle. Those are some of the identified risk factors for this colon cancer. Because of the recent data, the American Cancer Society actually did in 2018. They started recommending having this screening colonoscopy start at age 45 instead of waiting until age 50. And recently, United States Preventive Services Task Force, which is a major body that everybody goes by, started recommending having this screening done starting at age 45 and older every 10 years.
So thank you so much for that information, and thank you for telling us about the risk factors. Can you also provide some insights into who's at a higher risk for colon cancer, or who's at an average risk? Whether someone who has a family history of colon cancer, or a family history of cancer. But if you can shed some light on that, that would be very helpful as well.
So the people who are at risk are, if there is one of the family members, like first degree relatives, like parents, siblings, or children who had colon cancer or precancerous colon polyps before age 60, they're at higher risk. And also people with at least two relatives, whether they're first degree or second degree, even after age 60, there is slightly increased risk. As I said before, African American race, there is 30-40% increased risk, and compared to other races. These are the people who are at increased risk of developing colon cancer. And also in a small group, people with gene defects, they're at increased risk of colon cancer.
Okay. Dr. Kodali, can you also talk about like signs and symptoms of colon cancer? What signs and symptoms of colon cancer, what one should look out for if they were to prior to seeing their doctor, or if they're experiencing something?
So the majority of patients do not have any symptoms. That's the reason screening is even more important. Right. In advanced stages, some of the symptoms are abdominal pain, change in bowel habits like diarrhea or constipation, change in their stool size, passing ribbon-like or pencil-like stool, rectal bleeding, blood in stool, unexplained weight loss. These are some of the symptoms in later stages. But in the early stages, they do not have any symptoms.
Great.
Majority of patients. And
then now, can you also explain the screening process? So if one were to come to your office to get screened for colon cancer, can you provide some information about the screening process? If one were to come to your office to get screened for the colon cancer, what sort of screening processes they need to go through?
So majority of the time, patients are referred by their primary care providers, right, for the screening. And or if they have symptoms, most of them come from primary care providers. Yeah, we have a program called Open Access Colonoscopy. If you're young, healthy, do not have any major medical problems, and there is no need for them to come to the doctor's office and come and do an office visit. If we have a form. Most of the gastroenterologists are doing this. It's called Open Access Colonoscopy. They fill a form about their medical history, and we review that form. If they don't have any major issues, we talk to them over the phone about the procedure. We'll call in a prescription for the preparation and send them through their portal into their pharmacy, and we'll see them at the endoscopy for the procedure if they are young and healthy without any symptoms.
Can you provide some information about the colonoscopy procedure? How does it what do you need to do? How does a patient prepare for it? I know you mentioned something about them taking the prep kit prior to going through the procedure. So if you can provide some information on that, that will be very helpful as well.
Yeah, a lot of people, they read about colonoscopy from prior experience from patients in the past, but really it's not at all bad. I had my own colonoscopy, so I know from my experience. The worst part of all that is the preparation. You will be on a clear liquid diet for 24 hours prior to the colonoscopy. Then on the day before on the evening of the day before the exam, you take the prep, half of the prep the day before and half of the prep on the day of the exam. Then you will be drinking lots of fluids and water, and you will be constantly going to the bathroom. Can you hear me?
Yeah, I can hear you. Yes.
Yeah. So the worst part is going to the bathroom. That's it. After that, colonoscopy is like a breeze, really. And I had my colonoscopy, like I said, it's a breeze. So after on the day of the exam, they come to the endoscopy center. We put an IV. We give propofol, and they go to sleep very quickly. And the procedure is done in 15 to 20 minutes. And after that, they will wake up in less than 5 minutes, totally alert and oriented. And then they go home, and everybody comments, "Oh, I didn't know going." So every patient after the procedure, they say, "Oh, I did not know this easy. The procedure itself is. I would have done this long time ago." We
Yeah.
hear time and again, hundreds and thousands of times for 20 years, 25 years. Yeah.
Yeah, working as a practicing pharmacist, every time I had to dispense like a movie prep or like a soup prep or one of those big like go lightly, patients were like always concerned. But like after they get the procedure done, they'll come back and they'll always tell us that, hey, it wasn't that bad. Like I made it through. Like so, so I guess we both had like a similar experience with the patients being like very worried or like just anxious prior to the procedure, but once they go through the procedure, it's actually not that bad. Then how often one needs to go through this screening? Let's say if they get screened at the age of 45, do they get it like every few years, or do they need to wait? Like, do they need to do it every year if they're at a higher risk, or what's the recommended timeline for that?
So once they have a screening colonoscopy and it is very clean and exam and no polyps were seen, and patient has no risk factors for increased risk factors for colon cancer, once in 10 years.
Once in 10.
If you have polyps, you see polyps in anywhere between 25 to 40% of the patients. There are different type of polyps. Some are called precancerous polyps. If you do have precancerous polyps, you need to have that we call surveillance colonoscopy earlier than 10 years. It depends upon the type of polyps, the number of polyps, and the size of polyps. The repeat exam is anywhere from 3 years to 5 years to 7 years. So it totally depends upon the number, type, and size of the polyps.
And what are these polyps that you're referring to? Like how do you categorize them? Or sorry, go ahead.
Yeah, there are 4 kinds of polyps. One is called hyperplastic polyps. These polyps have no chance of developing into cancer. If you have those kind of polyps, you don't need another exam for the next 10 years. Then if you have precancerous polyps called adenomatous polyps or serrated polyps or flat polyps, then these polyps are at increased risk of growing into cancer over time. So whenever we see any polyp, we remove them, we send to the pathology to look under microscope. So if you have adenomatous polyp, again, as I said, if it is number and the size of the polyp, then we recommend anywhere between 3 to 5 to 7 years. And also one other thing, if you have first degree relatives, like I said, before age 60, then we recommend surveillance colonoscopy every 5 years instead of 10 years.
So the question is, what is the course of action? Let's say if you find something in the colonoscopy, what happens next?
So that is the beauty of colonoscopy, where not only screening, we also remove polyps then and there, thereby preventing the development of cancer. In rare instances, if it is cancer, or if it is a very large polyp which is not resectable, then we'll take biopsies of the lesions, confirm, and then we need to send them to a surgeon for a surgical removal, either through laparoscopic removal or robotic removal or open surgery for removal.
Got it. Okay, these are all very, this is all very useful information. Is there anything else you would like our audience to know about colon health, or like the screening of colon cancer? Please provide any additional information, if you would.
Yeah. Yeah, the things that we can do, anybody can do is increase the fiber intake, especially vegetables, fruits and vegetables, increase the intake of calcium and magnesium, and also increase having an active lifestyle. And also if you're 50 and 50 years or older, maybe taking a baby aspirin is not it's actually recommended until the age 69. Baby aspirin 81 milligrams once a day. There are other medications that showed benefit, like NSAIDs, like Sulindac, and also some cholesterol medications, statins, and very recently, antidepressants also found to the advantageous, but we do not recommend yet.
So I think I'm going to open it up to Q&A from our audience. One of the questions that came in is that this attendee would like to know if there are any correlations between COVID-19 and people having any sort of like GI problems or GI issues. Have you seen anything in your practice that correlates COVID-19 with like GI issues?
Not many. There are some reports like involvement of the liver, mostly, and also some vague GI symptoms. Not a lot, yeah. But we are still in the process of learning more about this infection, yeah.
The other question that came in is, are there any differences in symptoms for colon cancer between women and men, basically, or are the symptoms same for everyone?
About women and men?
Yeah.
Sorry. Yeah. No, they're actually both are at increased risk. Some people think that it is more in men than in women. That is true to some extent, but 1 in 23 men will develop colon cancer during their lifetime, risk of developing it, and 1 in 25 women also, they have a lifetime risk of developing colon cancer. So it's about the same in both men and women.
And the symptoms would be same too, right? Like they
yes.
Yeah.
Same.
Yep. Okay, so those were the two questions that that I see in the Q&A section. If anyone else has any questions, if they can maybe type them in, I'll be happy to ask Dr. Kadali. So we'll give you guys a few minutes.
And also, Viral, I want to mention Medley is doing a tremendous service. I know it's a business, but also it's helping patients, at least in the area where they provide this medicine, what do you say, the cheapest way and delivered to your doorstep without any cost to the patients. It's a great service.
Yeah.
It's a great business model too. Yeah.
Thank you so much for mentioning that. Like one of our goal is to, make sure that we are able to provide affordable and accessible care to all of our patients. Whether it's to bring medications to them, whether to apply like copay cards to make sure that they're paying less money out of pocket. And then, on top of that, we have a clinical pharmacist who work to make sure that patients are educated. So if someone's going through for a colonoscopy, we'll talk to them about the preparations that they're going to take, like how to take them. So we're very happy, and we're also very grateful to have a provider like you who works with us every day to make sure that we're able to serve all the patients that we have.
Yeah, our rep Andrew is very good, and he tells me that they shop and get the best rate for the patient, and if one drug is not available, they will find an alternative and let the patient know about that. That's a great service. Every day I get one or two. I send something, to national pharmacies. They say this is either back order, this is not covered by their insurance company. Back and forth it takes. And in the meantime, patient calls, oh, I cannot get my prescription filled. Yeah, I got 2 calls today, like I said this morning. Yeah.
Well, thank you. So one other question that came in for you, Dr. Kodali, is that can you speak about how the bowel preps or the preparations for colonoscopy have evolved over the years? I know it used to be like a big. They're asking about the colonoscopy prep kits and how have they evolved over the years. I know it used to be like a big preparation, and now it's a smaller like soup prep and like movie prep are like much smaller versions of the colonoscopy prep kits that are on the market now.
Yeah, definitely. Used to have, initially we used to have these gallon preps, and patients hated, that is their number one complaint for the having colonoscopy not being done. I cannot take this prep when they come back for the second time. Over the time, then we had the half the dose of that gallon prep. Still, some patients cannot and could not tolerate some of them. And then came the pills, and these were taken off the market, Visicol. And right now we have these small volume preps. They're very well tolerated. They take a bottle the evening before the colonoscopy and another bottle the morning of the colonoscopy, each time followed by 6 to 8 glasses of water or more. It's very tolerable, the preps these days are.
Well, so I think we're at time. So I want to thank you for your time today, Dr. Kodali. Thank you for providing us with this information. We've all learned a lot, and like I said, we're very grateful to work with you every day. And then, I'm sure we'll talk again. But thank you so much for your time today.
Thank you very much. I don't know. I'm so sorry for this internet thing. I do not know where the problem is.
That's okay. Thank you.
Thank you very much. Thank you for giving me this opportunity.
Yep. And thanks everyone for attending today. Thank you. Bye.
Thank you.